Hi, I'm Dr. Rubina Shanawaz, consultant robotic gynecologist with Fortis Hospitals, Bangalore. Today I'm here to talk about the rare manifestations of now common condition endometriosis and how to treat these rare manifestations. So if you go into why endometriosis happens or what is endometriosis, it is multifaceted, lots of theories. So it can happen to any girl right from puberty, right, a 13-year-old, a 14-year-old, up to a 45 or a 48-year-old. That is, till you get periods, you can have this condition. Now, what is this? Is that there, like how you bleed externally when you have your monthly cycles, a little bit of bleeding happens inside your body. So there are various, either it is because the blood is going back, or it's because these small nests of tissue which become activated over years for some reason. Now this old blood becomes like glue and it sticks the organs which are not supposed to be stuck together. Like for example, your intestine will come and get stuck to your uterus, or your urinary tract can come and get stuck, or this tissue invades the urinary tract. So all these are what are the different conditions in endometriosis. So how do you know and how do I know that you have endometriosis is one, you will present with pain, really bad pain in the stomach, which is not just confined to your periods, it will be there throughout the month, throughout anything you do. You use the washroom just to pee or just to, pass motion, and or it could be extremely painful intercourse, or it could manifest as fertility issue. You're trying to conceive and there is a problem conceiving, or in an ultrasound, it is picked up where it has formed a cyst. So all these are the common ways in which we detect you have endometriosis. Now the treatment is highly varied. It depends on how old you are, if you're looking to conceive, and what is the how severe this endometriosis is. Now today when I talk to you about the rare forms, it is that it can even not just stay in your uterus or your ovary or the intestine, which are structures which are very close to the uterus. It can even go as deep as your nerve, where you can get pain where you sit in the buttock region, or it can be constant hip pain, back pain, or it can even go up to the muscle which separates your lung from your abdomen, which is called the diaphragm, so causing hiccups. So it can be very different presentations. So one such lady who presented to us had an endometriosis which has gone right up to the nerve level, deep. It's called the sacral nerve root endometriosis, which is very close to the pelvic bone. Now, treating this is very difficult because medicinal, all the hormones, even the highest of hormones you give for such conditions, will keep your pain under control. But the minute you stop taking the hormone, it will come back with a rebound. So the only, as of now, we are still, researching a lot on endometriosis, but as of now, the only permanent cure is surgical excision of that particular lesion. It doesn't mean we are going to take out your uterus, your ovary, you can never conceive. No, it is where that disease is, take out just that particular segment, that pinpoint, because that will go a long way in leading a pain-free life and help you conceive. So due to this latest advancement which we have in our surgical fraternity, the robotic technology, it gives us that much more magnification and precision, because all these structures are very closely related to nerves which control your bladder function, your bowel function, so it's very easy to injure when we do it conventionally. So here, because of the technology which we have, we are able to precisely go up to only the diseased portion, take utmost care, make sure you are disease-free and fully functional, and at the same time, you're pain-free. That's the biggest advantage which we see, and which gives us a great sense of relief when our patients, the minute they come out of anesthesia, are pain-free. So these are all the late, rare presentations and the latest advancement which will help in tackle this new pandemic we see of rare presentations of endometriosis. Thank you.